Hi, this is Dr. Nemechek. Another one of our video blogs. I'd like to talk to you about brain fog. It's kind of a common term used by patients to describe just their brain doesn't work right. There's no clarity in thought. They can't focus. They can't remember things well. It's just basically something's wrong. And so if you're having this problem, you basically need to go and have some basic blood work done. So your blood counts, your chemistries, blood sugar, thyroid, some basic stuff like that. And if that's all fine, vast majority of the problems that could cause this disappear. They come off your diagnostic list. Now, if this has just come on rather quickly and maybe you have some other kind of alarming symptom, like maybe there's numbness in your face and arm, you might want to see a neurologist or somebody have a brain scan done. But for the vast majority of people, all of that stuff is normal. And they still have trouble with focus and concentration. The primary problem that we find that causes this, believe it or not, is actually the inability of your brain to generate blood pressure up to your head. So pretend this is your head here. And when you stand upright, gravity is now trying to drive blood from your head to your feet. Now, what your nervous system needs to do is actually push back. Okay? And you need perfect pressure up in the brain to get oxygen into the brain tissue. Now, so pretend this is a red blood cell. You breathe, you get oxygen in there. You got to push it up against gravity like this for the oxygen to get into your brain. And damage to your autonomic nervous system commonly results in impairment of this ability to get blood pressure into your head. Now, some people think they're dizzy and lightheaded as well as having brain fog, because what's happening there is when they stand up, suddenly the pressure in their brain goes, boom, drops like that, and they don't get enough oxygen. So they're more focused on like, whoa, what was that? This kind of woozy, dizzy, balances off kind of sensation. Now, after that happens, your pressure does not go to normal, all right? It's just not so obvious. You notice it when you stand up. Now, you don't have to have this lightheadedness when you get up, okay, to have brain fog. But my point is that's a more exaggerated part of the problem. And so after those people have, their lightheaded moment, their pressure does not return to normal. Now, the brain is not getting enough oxygen, all right? This is the most common cause of brain fog. It can be called, in a teenager, ADD, all right? If you're over 70, a formal term called minor cognitive impairment. They say pre-Alzheimer's or something like that. Those terms don't really make much sense knowing what we know now in neurosciences. But still, these are very common. It's a very common problem throughout life. And patients have some difficulty focusing. Now, some clues to this are people will notice if they don't eat, they get worse. And they'll miss diagnosis as low blood sugar, but really it's just that foods with salt and carbohydrates boost pressure to your brain, okay? And it'll make you feel better and clear up. So maybe like mid-afternoon, you got to have some kind of snack at work or a soda or something to help boost your blood pressure. Liquids will drive blood pressure to their head. So some people think they're dehydrated. Now, technically they aren't. It's hard to get dehydrated. You have to go like out in the desert and not have enough water to get dehydrated, okay? Or you got to have a lot of vomiting and diarrhea from a virus and not drink anything to get dehydrated. You don't just get dehydrated sitting in an office or your home, but you can feel better by putting more fluids in your body, because that will boost blood pressure to your head. And it kind of clears up your brain fog a little bit, all right? Another thing that helps is moving muscle, because when the system isn't working right and you aren't getting enough pressure up here, the blood pools in your legs. And people will find if they go for a run or exercise or a walk, the brain clears up. They may even found a job they like because they're on their feet a lot. And it's just when they sit down at their desk to focus and they got to maybe work on bills or whatever it is, some important report, and they just can't focus. And they got this brain fog, and it's because the blood pressure is dropping because they aren't moving their muscles. Okay, so brain fog, very common. You always want to have just your basic labs checked. MRIs, things like that, really are not necessary unless there's some other kind of focal, what we call focal symptoms, suggesting that's a problem. And then quite commonly it comes down to that the autonomic nervous system's been injured and you did not recover. And as I talked about in these other videos, you don't recover because you have too much inflammation. All right, inflammation prevents the brain from normally recovering from physical, emotional, and other inflammatory stressors, and it can leave you with a little brain fog because your brain didn't recover right. Now, the Nemechek Protocol, what we've discovered is if you lower the inflammation enough, your natural repair mechanisms turn back on, and your brain can actually fix this damage. And even if it's been for 30 years, all right, there doesn't really seem to be a limit on recovery. And so, Nemechek Protocol, high DHA fish oil, olive oil, vagostimulator, and we fix the intestinal balance in your gut. That's all for today. This is Dr. Nemechek. Have a great day.